COPD oxygen therapy. What are your delivery options? If you or someone you know has chronic obstructive pulmonary disease, you might be curious about how oxygen therapy works and what options are available. Oxygen therapy is essential for managing low blood oxygen levels, also known as hypoxemia. Let's break down the different delivery methods you can choose from. First up is the nasal cannula. This is the most common and straightforward device. It consists of two small prongs that fit into your nostrils. It delivers oxygen at low flow rates, usually between 1 and 6 liters per minute. With a nasal cannula, you can still talk and eat while receiving oxygen. This option is often used for mild hypoxia or for long-term oxygen therapy at home. However, be cautious, as flows above 6 liters per minute can dry out your nasal passages. Next, we have the Venturi mask. This mask is designed to deliver a precise oxygen concentration by mixing oxygen with room air. It is particularly useful during acute exacerbations of COPD, where maintaining oxygen saturation between 80 and 92% is vital. The typical oxygen concentrations delivered can be 24% or 28%, with flow rates adjusted accordingly. Then there are the simple face masks and non-rebreather masks. These cover both the nose and mouth and can provide higher oxygen concentrations than nasal cannulas. Non-rebreather masks can deliver oxygen concentrations of up to 60 to 90%. They are often used in emergencies but are less common for stable COPD patients, as high oxygen levels can sometimes worsen carbon dioxide retention. Another option is the high-flow nasal cannula, which is a newer technology. This device delivers heated and humidified oxygen at higher flow rates than standard nasal cannulas. It can improve oxygenation and patient comfort, making it a great choice in hospital settings for patients experiencing acute respiratory failure. Non-invasive positive pressure ventilation is another method worth mentioning. While it is not strictly an oxygen delivery device, it provides ventilatory support along with oxygen. This option is used for COPD patients who are experiencing respiratory failure, helping to improve gas exchange and reduce the effort of breathing. For those with chronic hypoxemia confirmed by arterial blood gases, long-term oxygen therapy is often prescribed. This therapy typically requires the use of a nasal cannula for at least 15 hours per day. Regular reassessment is essential to ensure that the patient continues to need oxygen and is receiving the correct dosage. Lastly, there are face tents or face shields. These devices deliver oxygen around the face without a tight seal. They can be beneficial for patients who cannot tolerate masks or nasal cannulas. When considering oxygen therapy for COPD, it is essential to target oxygen saturation between 88 and 92% to avoid worsening carbon dioxide retention. Also, be mindful of excessive oxygen flow rates, as they can dry out mucous membranes or disturb sleep. Always prioritize safety, especially regarding fire hazards around oxygen equipment. In summary, there are various oxygen delivery options available for managing COPD. Choosing the right method depends on the severity of hypoxemia, patient comfort, and the clinical setting. Understanding these options can help you or your loved ones manage COPD more effectively.